today is a special day for me, my colleagues in the Forum of Commissioners, but also, broadly speaking, all subnational health leaders, including heads of DMA. We're here, a culmination of weeks-long, months-long conversation and technical work to pull together, and bring forth a framework for group purchasing across states for health commodities and consumables.
We've seen the needs of the manufacturers, which basically is assuring us of their capacity, to be able to guarantee volume as long as the states are able to patronize them. We've also learned about the state's commitment and willingness to actually go into this pool procurement as enshrined in the pool procurement framework.
When you pool your resources, you know that of course you'll get more value for your money, and then of course the manufacturers, the full advantage is that they will be able to plan, and for the states, because you're pooling, you're giving a lot of money, you are giving your quantification, you are able to get a lot of discount or negotiation on that.
The partnership becomes a lot more defined because everyone needs to communicate. So not just between the different groups, again, pharma companies and states, but amongst ourselves. So for example, within the states, they're having to now think very clearly, think very strategically about their demands. You put it together in a way that sort of makes sense. Again, collectively, communicate that to us as a pharma group, and we again come together collectively, look at this thing from the states, and we sort of work together to make sure everything is supplied well. So ultimately, obviously, the goal is to strengthen the Nigerian healthcare supply chain.
One of the key takeaways for me from this meeting is how different stakeholders have come together in a forum like this and speaking with one voice, showing their commitment to making healthcare delivery work in Nigeria. If there are no drugs, patients suffer, patients die. So when you have pool procurement where the states are pulling together, if one state or if one manufacturer doesn't have enough, because they are working with other manufacturers as a group, they can flexibly share products amongst themselves. Similarly, if one state is down in terms of stock, because they are pulling together, they can easily transfer drugs from the states that has no or that has excess drugs to the one that has no drugs. Quality is assured, it is consistent across the states, delivery is assured, price benefits, speed of delivery benefits, availability of drugs is assured as well. So these are some of the potential positive impacts of pool procurement.
It enables, the manufacturing industry in the country to grow, and also enable the country to be able to produce the items that are actually needed to be consumed in the country.
The prices of commodities that we're getting will be cost effective. I will not say cheap, it's cost effective because you are getting quality and then value for your money.
Thank you to ASM for all the work that has been done, and of course to the Arizona State University for helping up with the technical underpinnings for this group purchasing framework. And of course our partners, the Pharmaceutical Manufacturers, who have shown tremendous support, who have given their all and commitment to driving this process and taking it forward.
If it were not for ASM, probably this wouldn't have been, all this have not been possible.
They actually were the ones that pushed for this policy, because they're the ones that connected us with the Arizona State University, who had this research. And of course, this framework is developed from the research that was done by Arizona.
Working from the PPP arrangement that we had starting from 2020, and development of various policies and programs to ensuring upskilling of staff that are going to be managing these processes. I think those are the kind of impacts that we have seen played by ASM. So ASM, I think, is an integral part of this journey, and the impact is really there for all to see.